Serving all of San Diego, this is your Fox 5 News.
Well, it is time now for some good old-fashioned grown-up talk. It's a good time to go ahead and give your kids a break from the TV, maybe put them in the other room, give them a coloring book or something like that. Dr. Irwin Goldstein, the director of sexual medicine at Alvarado Hospital, and Debbie Cohen, a physical therapist at San Diego Pelvic Rehab, are here with exercises that can help you improve your sexual health. Okay, let's first of all talk about this pelvic floor exercise, what it is and what the deal is with it. Dr. Goldstein, we'll have you start.
So basically, female sexual dysfunction is very common. It's 40% of women have this. 10 million women are bothered by this. We've been talking over the years that we've been here on drugs and sexual therapy with Dr. Hartzell, but we now realize, I don't know if you can see this, but this whole bottom part of the pelvis is surrounded by muscles. And those muscles can be either too loose or too weak or too strong and too tight. And they can influence sexual function. So what we've learned is that engaging a physical therapist in this village plan to take care of men and women with sexual problems. So we have a sex therapist, a physician, and we have a physical therapist is really the ideal way to do all this.
So are pelvic floor exercises basically kegels? Are they the same thing?
Yes, basically a pelvic floor contraction is called a kegel, but the problem is that many women who have been told to do this aren't doing them right, or they may not really be the ones who should be doing it because some of their problems may have to do with too much tension in these muscles.
So how do you know if you're one of the ones that shouldn't be doing it?
Well, that's where it takes a proper assessment, diagnosis, evaluation by a specially trained physical therapist who's trained to see what's going on in these muscles and help a woman do the proper thing and do any hands-on therapy that's needed as well.
Okay, so can we discuss carefully, because we're a morning show, how to properly do it so people at home can know they're doing this correctly?
Okay, so a proper pelvic floor muscle exercise includes contracting and relaxing the pelvic floor muscles. What that feels like is if, for example, if you're in the middle of urinating, if you would stop your urine in the middle, that's a contraction of the pelvic floor muscles. And then to release them, fully relax them and let it go is an important phase of the exercise too.
So how are people doing them incorrectly?
There may be an idea of bearing down or pushing instead of contracting and lifting the muscles, and they may not be fully letting go when they try to relax. They may not realize that's an important part, and it may not be properly coordinated with the breath. The way that you breathe while doing it is important, in particular that you do breathe.
Dr. Goldstein, is this something that all women should be doing? I know they tell you leading up to childbirth that you should do it and then afterward, but is this something everybody needs to be working on?
Speaking of childbirth, so don't you think your muscles have been altered by this whole experience, the 9 months?
This is not about me. This is going to get awkward. Okay, we're going here.
No, but the point is, it's such a common thing, and it's beyond the pelvic floor. It's the core muscles, the abdomen, the back, the neck, the legs. I mean, it's musculoskeletal, really, assessment, of which the pelvic floor is a part. We have women with low interest, we have women with poor climax situations, people with low arousal responses who do very well with this sort of village therapy. They speak to the sexual therapist, we find hormonal or drug strategies, and they work on either tightening or relaxing the pelvic floor. The problem with everyone wants to do kegels, if your muscles are already too tight, then doing kegels is really the wrong thing to do. It's the other side of the kegel, as she described, the relaxation phase.
Gotcha.
And by the way, this works for men too. We always talk about this for women.
Really?
We have tons of men who have tight pelvic floors for various reasons. Bicycle riding, injury to the muscles of what you sit on the muscles when you ride the bicycle.
Okay, we need to have you back to go into that because that's a whole different thing.
It is, and it's fabulous.
The bottom line here for women watching today
is that if you have any problems that you think may be related to these muscles, pain, urinary incontinence, anything that you think just may not be right with your muscles, and the history of back pain, hip pain is very much included, please ask your doctor for a prescription for a physical therapist and see a properly trained pelvic floor physical therapist.
Good stuff. Thank you. Appreciate it.
There's only 5 certified pelvic floor physical therapists in San Diego, so not many people who can do this.
Very good. Okay, thank you. To reach Dr. Goldstein or Debbie Cohen at San Diego Sexual Medicine Alvarado Hospital, all you have to do is visit our website, Fox 5 San Diego, and click on that Scene On tab. Mr. Martinez, back to you.
Guys, thank you. And to reiterate, this is not about Erica Fox. It's not about Erica Fox. Thank you, guys.